Good evening, everyone, and welcome to the Ajax Public Library's program, Navigating the Healthcare System, presented by the Ontario Caregiver Organization. My name is Julia Campbell, and I'm the Adult Services Librarian at the Ajax Public Library. I just wanted to start by covering a couple of housekeeping items. Tonight's presentation is being recorded, so I would ask that you please keep yourself muted so you are not heard in our recording. And then we will have a Q&A portion after the presentation, at which point I will stop the recording to protect everyone's privacy and so that everyone feels comfortable sharing and asking questions. And at that time, please feel free to unmute yourself and turn your camera on if you wish to do so. And if you have any questions for our presenter, Shrid, please type them into the chat. And just to get the chat started, if you wouldn't mind sharing where you're logging on from today in the chat, I would love to see where everyone is tuning in from tonight. And if you experience any technical difficulties, I recommend that you exit the Zoom and re-enter. And if you continue to have difficulties, please place a comment in the chat and I will do my best to assist you. So now it is my pleasure to introduce our presenter from the Ontario Caregiver Organization, Shrid Dungal. Shrid is a full-time dad to a 5-year-old and an 18-month-old. And in his spare time, he works with the Ontario Caregiver Organization as the regional lead for community engagement for the Central Ontario region, including the GTA. He has over 7 years experience in Canada in stakeholder and community engagement and in co-design work. He holds a Master in Public Health degree and has worked in global health initiatives in developing countries as well, all prior to him immigrating to Canada. We are lucky to have him with us tonight. So without further ado, I will turn it over to Shrid to begin his presentation. Welcome, Shrid.
Thank you so much, Julia. And thank you everyone for having me today. For the purposes of the presentation, I'm going to turn my video off so that there isn't any glitches. Something always happens. So at the end, once the presentation is done, I am more than happy to come back on video and answer any of your questions. So I would like to begin today by acknowledging the Indigenous peoples of all the lands that we are on. While we meet on a virtual platform with people joining us from across the province, I would like to take a moment to acknowledge the importance of the land. As an immigrant to this land, I have a deep appreciation of this place that now my family and I call home. I'm continually learning the history of the land, recognizing that that history has seen immense tragedy, hardships, and injustice. However, by trying to understand that tragedy and injustice and by standing with the Truth and Reconciliation Commission, my family and I have renewed our commitment to honor this land. I invite you to take a moment to reflect on the land where you are. And if you're not familiar, you can visit native-land.ca. I'm happy to share that website on the chat box, and you can take a look and see where you're from and what history lies where you live. And as is customary in my culture, to pay respects and honor everyone, and when we start a new journey, I start by saying namaste and thank you very much for having me. So let's dive right in. So I'm coming to you from the Ontario Caregiver Organization, and let's start by defining who a caregiver is. So we at OCO, that's what we refer ourselves to, OCO, define family caregivers as any family members or friends or neighbors who provides care for someone in an unpaid capacity for whatever reason. So it could be due to an accident, it could be due to frailty, it could be due to a disease, it could be due to a range of reasons where we provide support and assistance to those individuals who are providing assistance to others. We work with everyone across the province, regardless of their age, regardless of their background, and regardless of what disease or what the situation may be. So when we're looking at caregivers across the province, we do a yearly report to get more insights into who the Ontario caregivers are. So we know that there are about 4 million caregivers across the province, family caregivers across the province, the majority of which are employed, are married or partnered, and are parents. Now you see the words there that says sandwich generation. So we know that there are a lot of individuals who are between the age of 36 and 65 who identify as caregivers, as primary caregivers, so 59% in Ontario. And when we refer to them as sandwich generation, that means that they are taking care of someone who may be older to them, while also taking care of someone who is younger to them, right? So they're they're in the primary caregiver role for more than one individual and are taking care of either medical needs as well as personal needs. When I say personal needs, they could be parents or they could be children of older parents who are just older and frail. And then we also see that when we're looking at them from a gender perspective, they're pretty evenly split between men, those who identify as men and those who identify as women, and 1% who identify as non-binary. If I'm going too fast, please do let me know. So who are they taking care of? So most caregivers are taking care of one person. However, 1/5 are taking care of more than one person. That means that they are the primary caregivers to one person, but maybe supporting another caregiver to take care of someone else as well. Half of caregivers say that their top responsibility is to provide emotional support to the care recipient. And the other responsibilities include, but may not, there may be others as well, but primarily they offer behavioral support to those individuals who may be having responsive behaviors. They offer physical support, such as lifting and moving. They offer basic medical tasks, such as administering medications, while also providing some complex medical tasks, such as changing the G-tube, giving injections, right? And also personal care, such as bathing. So those are primarily the top activities that caregivers provide support for. And now, because of the pandemic, we are seeing that there is a considerable number of caregivers who are taking care of folks who have complications as a result of getting COVID-19. And we'll talk a little bit more about and go into detail about how COVID-19 has changed the caregiving landscape as well. So what is the impact of caregiving, sorry. So a strong majority of caregivers often feel anxious and worried, overwhelmed, frustrated, helpless, and trapped, and experience disturbed sleep. In fact, when we spoke with caregivers, we saw that two of the biggest issues that caregivers said they've faced over the pandemic now is, number one, is increased costs because of the pandemic and because of more caregiving responsibilities, and number two is lack of sleep. So almost 50% of caregivers say that they experienced disturbed sleep patterns because of the increase in caregiving hours or increase in direct care for the care recipient. And we also know that there are a large number of caregivers who are finding it more difficult and more challenging in balancing their caregiving responsibilities with their professional lives and their work. So we have some programs in-house as well that can help caregivers work with their employers, for example, on creating more caregiver-friendly workspaces. So who are we? Who is OCO? So OCO is a fairly new organization. We came into being established in the spring of 2018, and we're an independent nonprofit agency, but we are directly funded and accountable to the Ontario Ministry of Health. So the organization was established in response to recommendations in the Expanding Caregiver Support in Ontario report by Janet Bede in 2018. And our main focus is to be that one-stop shop for information for caregivers across the province. If they want to find information around education opportunities and information around supports, respite care, mental health and well-being, whatever it may be, we want to be that organization that can help caregivers find the supports for the person they're caring for, but also for themselves, recognizing that caregiving can be really stressful and can lead to a lot of mental and physical illnesses as well. So what do? We primarily operate on a set of strategic priorities. Number one, increasing the public's awareness of the role of caregivers in our communities. So educating not only caregivers around what it means to be a caregiver and what to expect when it comes to caregiving, but also informing people everywhere around the contributions of caregivers and what value caregivers bring to the healthcare system, for example. Number two, we understand Ontario's caregivers and their needs by leading research into Ontario caregivers to understand the different profiles of caregivers and the diverse needs of caregivers based on the communities they live in and the communities they come from. Number three, we partner with government to give voice to Ontario caregivers. So we are present in many tables across the province with the government to inform them of the different gaps that caregivers identify and the different service needs that caregivers feel are essential to make their caregiving journey easier. And we work with, for example, the Ontario health teams, with different hospital boards to make them understand the value of caregivers and what caregivers can bring to the table in terms of providing care to the care recipient. And then we also inspire innovation and amplify existing programs. So a large part of what we do is we create partnerships with different subject matter experts and agencies across the province. And we do not want to replicate or duplicate any services. So we partner with subject matter experts and expert agencies so that we may be better able to direct caregivers to those expert care providers who can provide them meaningful assistance. When I say meaningful assistance, not just provide them with resources, but really provide them with the know-how on how to make their caregiving journey less stressful and more easier. So I spoke a little bit about our research. So we continually research into understanding caregiver profiles across the province. So we do what we call a spotlight report on a yearly basis to help us gauge gaps in service and also therefore caregiver needs. So there are multiple touch points or opportunities for feedbacks with caregivers, which I will discuss as we go along through our presentation. So there are different avenues where caregivers can provide feedback, and we have different avenues that we solicit feedback from caregivers as well. So what does the latest Caregiver Spotlight report tell us? So the latest Caregiver Spotlight report tells us that there are a lot of caregivers who are burnt out, and there are a lot of caregivers who need help, and there are a lot of areas where we can improve as service agencies. We see that these numbers have continually gone up, especially during the pandemic. And a lot of caregivers have said that their mental health and well-being have taken a really bad hit due to the pandemic, right? So about 6% of caregivers say that they've been providing care for COVID-19 related complications only, and that 15% have been providing care for someone in the past 12 months with an added responsibility due to COVID-19. And 79% have been providing care for someone in the past 12 months for the non-COVID related healthcare issues. When we're looking at how COVID-19 has changed the caregiving, we see that 75% say that they take on responsibilities that otherwise would go on to personal support workers or nurses. So the COVID-19 pandemic has resulted in many restrictions and closures. And as a result, they haven't been, folks haven't been able to go into the house, for example, to offer the vital respite services to caregivers. So as a result, caregivers have had to take on a huge part of the burden, a huge part of the responsibility to take on care. So we know that on average, caregivers are taking on an additional 10 hours on top of their regular caregiving responsibilities to provide direct caregiving care. When I say direct caregiving care, I mean it could be bedside assistance, it could be changing the person, incontinence products, whatever it may be. Besides that, there may be other responsibilities which aren't accounted in that 10 hours, such as grocery shopping or driving someone to an appointment and back. So all of that is indirect services that they provide, right? So we know that caregivers are stretched and we are trying to work with different agencies to make sure that we are able to provide support to caregivers. And based on what we saw during the pandemic, especially around changes in service and long-term care settings, we heard feedback from caregivers saying that a majority of them felt that if they were not there to present to help at the care facilities, their family member or friend would not get the same level of care. And that was very clearly shown during the pandemic, where when family members were not able to go into the home, the health of those care recipients at long-term care and institution-based settings really declined at a faster pace than it did before the pandemic. And that's very clear in the numbers that we see. So what do we do? What can we do? So there are some resources in order to meet most of these gaps that I identified earlier on. We've curated some resources and tools that can help the caregiver ease the burden of caregiving. Before I continue, anybody have any questions they want to ask on any of the data that I presented? I know that was a lot. I'll be more than happy. I am sharing these slide decks with Julia, and I'm sure she's going to send it out to everyone after, so you don't have to be frantically writing anything down. So far, so good? Okay, I'm going to continue. So we at OCO have developed toolkits based on the situation of the caregiver. So we have toolkits for folks who are caring for an adult, caring for an older adult or a senior, or caring for a child or a youth. And we have resources that help caregivers communicate better with healthcare providers and make sure that healthcare providers listen to them, and healthcare providers recognize that caregivers provide an insight into the care recipient and into the lives of the care recipients, and that care provider and caregivers are essential when it comes to providing care for the care recipient at home. We have toolkits for caregivers to recognize the types of care providers and what kind of services are available from each type of care providers, and also helpful definitions when it comes to medical terminology and terminology that care providers use in their care in care settings, in hospitals and long-term care. So you can find all of these resources on the link that is provided on the slide there. And for most of these slides that you will see, there are links provided, so you can easily go and find those resources. So one of the resources that we have, which is focused on the caregiver, is a toolkit that was developed during the pandemic, and it is a really handy tool and helps caregivers identify care recipient needs and their own needs and how they can help navigate those needs as well. So the toolkit includes important information for, it could be a new or a seasoned caregiver, and it was created by caregivers for caregivers themselves. The toolkit focuses on how to take care of themselves and how caregivers can be empowered to take care of themselves. There are tip sheets and tables that can help caregivers build a support team, for example, and also a self-assessment tool to really see how the caregiver is coping with their caregiving during their caregiving journey. And then the toolkit also provides information on how to avoid burnout, how to avoid compassion fatigue, and also point you towards resources that might be helpful. Another toolkit that we have is the My Healthcare Journey Binder. So the Journey Binder helps caregivers organize all relevant information regarding the care recipient and themselves all in one place. Caregivers can use it with care recipients to communicate and manage healthcare information, appointments, and document interactions and questions and queries. So sometimes when we go to the doctor, we have a bunch of questions that we want to ask, but when we get there, because the conversation takes a side turn, we might forget to ask some very important questions. So the healthcare journey binder really helps you document what you're seeing at home when it comes to care and how you want to reflect that in the conversations with a healthcare provider. The binder is organized into various sections, which you can download separate sections, or you can download the whole binder as you like through that link there. And the sections highlighted are: there's an introduction section, there's a personal information section, there's a medication therapies and allergies section, medical history section, consent and legal matters section, healthcare team notes section, and a care template section. So a care template section could be something as, okay, if I'm not there to provide care, if I have to go somewhere, then the person who replaces me knows exactly what to do and how to do it and when to do it, for example. So this is one toolkit that is very helpful for caregivers as well. Next, we also have tools and tip sheets around health privacy and consent. So Ontario's privacy and consent laws are very complex and can often be a barrier to effective communication between a care provider and a caregiver. So there are resources that explain legislation and in very easy to understand language. A good resource for both care providers and caregivers. So all of these resources can be used by either a caregiver or a care provider. So the resources include a comprehensive guide, tip sheets, FAQ resources around different caregiving situations, including how privacy consent works, and while caring for someone who is incapable of making their own decisions. So it talks a little bit about incapacity and capacity and how that is a fluid concept, and really helps caregivers understand in plain language how they can best navigate all of the health privacy and consent resources. We also have an e-learning platform which we recently launched, which has courses for caregivers as well as for healthcare providers. The courses you see on the screen are for family caregivers. The Caregiver 101 is a great course for seasoned as well as new caregivers around learning what it is to be a caregiver, what the journey might look like, what to expect, how to avoid burnout, and a range of different issues as well. We also have a course around caregivers partnering with healthcare professionals. So this is a course that really helps caregivers understand how best to interact with healthcare professionals and how to get their point across, and how to get the healthcare professional to recognize that they are an essential partner to care, and that they are very important when it comes to prescription adherence, for example. So if there's a medical prescription or a social prescription, recognizing that the caregivers are essential to make sure that those prescriptions are filled is very important for the healthcare professional to understand. So these tips really help caregivers communicate better with healthcare professionals to make them understand the importance of caregivers, for example. We also have resources for healthcare providers in our Healthcare Provider Resource Center. So if you are with a healthcare provider and if you're going to meet someone and you want to tell them about all of our resources, please feel free to do so. One of the resources we have is called the Time to Talk Toolkit, and I'll let Sandy here talk a little bit about her experience, and then we can move into the toolkit as well.
No one ever said, "How are you doing today?"
Oh, sorry.
They would smile. They don't know what we can provide here. We might be able to, but are there other resources in your life? And if they had the time to ask that, that would be a major step going forward.
So what Sandy was talking about is our Time to Talk toolkit. So based on feedback from caregivers, we designed a toolkit to help care providers support caregivers through various tip sheets that are available for care providers, as well as pamphlets and posters that they can use in their offices around talking to a caregiver, simply asking the caregiver how they're doing, so that a caregiver feels that they're seen, and that they recognize that that the healthcare provider understands what they're going through. Because a lot of the time, similar to what Sandy talked about, when a caregiver starts talking about how they're doing, then they might see themselves as a patient, and they don't want to do that. So the tip sheets and the Time to Talk Toolkit is really a great way for care providers and family caregivers to start the conversation around making sure that the caregiver is recognized and that they're supported through their caregiving journey. Similarly, we have tons of toolkits for care providers, which can be accessed through our care provider summary one pager. So you can access this through the link there. So let's talk about programs and services that are now available for caregivers and how they can find out more about these programs and services. So again, based on feedback from during the pandemic, we got a lot of feedback from caregivers saying that they were not really finding one place where they could find information around programs and supports that might be available for them based on where they lived. So we partnered with 211 Ontario to initiate the 24/7 helpline. So the Ontario Caregiver Helpline is a 24/7 service for caregivers to call in to access any supports based on where they live. So the helpline is a system navigation tool for caregivers to find information around respite care, home-based services, education and community resources, and also around their technology needs. So the helpline, we've partnered with 211. We've trained staff at 211 to intercept and respond to caregiver-based inquiries. So when you do call this number, they will be able to guide you to services that might be available at OCO, but also on the ground services based on where the caregiver is calling from. So if they're calling from Sudbury, for example, then they're referred to agencies and support services that are available locally where they are. And as of April 2022, we are providing this service in 140 different languages throughout the province. So if you know any caregivers, or if you are a caregiver and you're looking for supports, feel free to call this number and ask for any information that you need. We also have a SCALE program, which stands for Supporting Caregiver Awareness, Learning, and Empowerment. So this is an 8-week program, but it's a 2-session, 4-week program, which really focuses on the caregiver's mental health and well-being, and it really focuses on how caregivers themselves can be empowered to take care of themselves. What's unique about this program is that once they sign up for this program and they attend the program, they can enroll for either a one-to-one session or a group counseling session, just based on their needs and based on a screening that is done by the facilitator of this program. This program is facilitated by a registered nurse as well as a registered social worker, and we run this on a cyclical basis through our website as well. So again, any of these programs, you can either call the helpline or you can go onto the link that's provided on the slide to access information and register for these programs. We only recently finished the last cycle for this program, so the next cycle for this SCALE program starts in September. However, if anybody is interested, we do have a YouTube channel, which I'll give you the link for a little bit down the road, where you can find all of these sessions recorded and available on our YouTube channel to watch at any time you feel you have. Next, we also have online caregiver support groups. So the support groups were created as a offset to any support groups that caregivers were attending in their community, but were closed because of the pandemic. So there were a lot of caregivers who said that because of the closures and restrictions during the pandemic, they were not able to attend those one-off support groups that they had in the community, either through their local library, their community hubs, or through faith-based centers. So we started these support groups as a more of a stopgap measure where caregivers can come together and meet other caregivers and find more long-term supports in the communities that they are living in. So if someone, for example, is caring for someone with Alzheimer's disease, they come to the online support group, find a network of individuals, and then maybe get directed to the Alzheimer's Society for more long-term supports, for example. And then also based on feedback from young caregivers saying that some of the conversations that were happening in the generic groups, they were not really resonating with them. So we created an online support group specifically for young caregivers between the age of 15 and 25 that they could access every Wednesday, 7:30 to 8:30 p.m. And I'll talk a little bit about our young caregiver program also as we go along. Next, we have our one-to-one peer support program. So, sorry, the peer support program connects experienced peer mentors with caregivers who are going through some difficulties in their caregiving journey, especially around emotional needs. So on the face of it, the peer support program is built as a telephone-based program where the peer mentor and the peer and the caregiver connect over the telephone to get any emotional-based supports that they may need. The peer mentor is trained through OCO on how to be a peer mentor, and we request that if they do sign up to be a peer mentor, that they do for 1 year so that they can build a rapport with the caregiver as well. Excuse me. Next, we also have webinars, a range of webinars that are available through our website. Sorry, and you can access it through our events page, ontariocaregiver.ca/events. And if you miss any of our recordings, you can go on to our webinars page to access any of our old recorded webinars. We have webinars such as transforming caregiver guilt and resentment, cultivating mindfulness. We have webinars on the different A's of dementia, and webinars for caregiving for adoptive parents, or a range of different topics. Sorry. And then also you can access them on our YouTube channel as well. For those individuals who don't have time to turn on the computer or listen to a webinar, we do offer a free podcast, also called Time to Talk, which is available through major podcast providers such as Spotify, Google Podcasts, Apple Podcasts, and we have 2 seasons now that they can download for free. And topics include such becoming a caregiver, keeping relationships strong, managing money. Season 2 deals with more around navigating the healthcare system, caregiver mental health, and the cultural differences in caregiving as well. So feel free to download these and listen to them at your own time as well. I should mention everything we have is free of cost. We don't charge anything for any of our programs. So feel free to access them at your own time as well. I mentioned our Young Caregiver program. So our Young Caregiver program is now live and running. We've been running it for about 1 year, and we maintain a sister website called Young Caregiver Connect, where young caregivers between the age of 15 and 25 can go and participate in various forums. It is all private and confidential. We as OCO staff only help with the operational side of things, but these forums and the content on this website is all driven by young caregivers themselves. Additionally, we have various opportunities where caregivers are able to participate in our advisory panel, in different working groups, and provide feedback onto what they're seeing on the ground in terms of services and supports that's available for caregivers. So through either working groups or different volunteer engagement opportunities or one-off sessions. For example, we recently had focus groups on the change in services and gaps that caregivers saw during the pandemic in long-term care setting. And what their recommendations were on changes that they wanted to see in long-term care, so that we avoid all of the mistakes we made during the pandemic when it came to our long-term care setting and working with caregivers as well. We also are available on Facebook, Twitter, Instagram, YouTube. You can go and join any of our sessions through our social media platforms. And we also have a monthly newsletter called Caregiver Connect. You can directly go onto the link and sign up for the Caregiver Connect newsletter, which will keep you updated on all of our programs, resources, and what's new at OCO, and also opportunities for caregivers to provide their feedback as well. Lastly, that is my contact information. If you have any questions around anything that we discussed today, please feel free to give me send me an email, and I will respond accordingly. Okay, I'm going to stop share and turn on my video again. I again apologize for that moment of madness with the video. I don't know what happened there, but if anybody has any questions, I'd be happy to take them now.